morning and welcome. On behalf of Conduent Healthcare, we're glad you have joined us today for our webinar entitled Managing the Cost and Care of Sepsis Across the Continuum: How Analytics Can Improve Sepsis Performance and Patient Outcomes. So, now let's begin by introducing today's speakers. Our first presenter is Sarah Gunder. Sarah is a clinical informaticist with Conduent Healthcare Innovation Insights team. She's a registered nurse with 16 years of experience in the healthcare industry, including case management, managed care, population health, informatics, and quality improvement. Our second presenter is Jamie Pearson. Jamie is also a clinical informaticist for Conduent Healthcare on the Innovations Insight team. Her 23 years in nursing include pediatrics, oncology, information technology, and clinical quality improvement. We are also very happy to have the team from Lancaster General Health, part of the Penn Medical Health System, with us today to share their experiences with the Conduent Sepsis Insights Dashboard. Let's start by quickly running through our session agenda. We're going to look at sepsis challenges. You're looking at the prevalence and the magnitude hospitals face dealing with sepsis. We'll look at solving sepsis. How do you look at these challenges holistically? Then we will present the Insights Dashboard in action with a live demo. Our panel will then speak to their perspective in using the dashboard. They will walk through some key takeaways, and then finally we will address Q&As that are posted and share with you any final additional resources. So now I will turn the presentation over to our first presenter, Sarah Gunder. Sarah, it's all yours.
Thank you, Anna. Good morning, everyone. So what are the challenges we face with sepsis? We know as healthcare providers, sepsis has a significant financial burden on the healthcare system and our patients. With a high rate of mortality and readmissions, as well as longer than average length of stay, the costs and outcomes are staggering. Now let's take a look at a breakdown of these challenges. Sepsis patients have a 75% longer length of stay, and approximately 270,000 patients lose their lives to sepsis. 1 in 3 patients who die in a hospital setting have a sepsis diagnosis. Sepsis is the #1 cause of readmissions in the United States. 19% of sepsis patients are readmitted within 30 days. According to the Sepsis Alliance, sepsis is the #1 cost affecting U.S. hospitals. Sepsis accounts for $62 billion of healthcare costs annually, and it continues to rise year over year. So what is the solution? Providers must be able to identify gaps in care and rely on solid data and analytics. Our Sepsis Insights Dashboard gives us that opportunity to quickly identify sepsis patients and opportunities to improve performance and patient outcomes. According to a recent study, analytics have been shown to reduce sepsis mortality by 39%, length of stay by 32%, and readmissions by 23%. So let's take a look at some of the key features of the Sepsis Insights Dashboard. Our dashboard provides users with guided analytics, timely and interactive reporting, and key performance metrics. The dashboard allows users to monitor sepsis activity, export data, and establish a foundation of sepsis-related key metrics. The dashboard also provides end users with dynamic visualizations, patient-level details, and a daily refresh to quickly identify gaps and opportunities. So now it's time to take a look at the dashboard in action. At this time, Jamie will provide a high-level demonstration of our Sepsis Insights Dashboard.
Thank you, Sarah. Now I'd like to give a demonstration of our Sepsis Insights Dashboard. The Sepsis Insights Dashboard populates those encounters with a primary or secondary diagnosis of sepsis. Before I get into the details of the dashboard, I'll give an overview of what you're seeing on your screen. The top of the dashboard are our global filters. Along the left side of the dashboard are our key performance indicators. And then within the main page of our dashboard are what we call widgets. For organizations with multiple facilities, users have the ability to select one or many facilities. Also have the ability to select that attending physician specialty. So you may want to look at that family medicine group or your hospitalist group. Here you'll do the selection and the dashboard will update based on the filter selected. Users also have the ability to select to that attending physician, so you can get to that provider level. Users also have the ability to select the view by. So for our widgets and trend lines, users can select to view either month, quarter, or year. For our demonstration today, I have selected quarter view. We also have the filter for the discharge date. So you can select that discharge date for the timeline for the encounters that you're reviewing. On the left side of the dashboard are our key performance indicators. So you'll see the first KPI is our total encounters. Again, these are those encounters with that primary or secondary diagnosis of sepsis. The next KPI is our total 30-day readmissions. This populates those encounters with that index encounter of sepsis, and then they return to your facility for any diagnosis. You'll see on this KPI, we're showing the total number of encounters and also that total 30-day readmission rate. The next KPI is our total 30-day sepsis readmission. This will populate those encounters with that primary diagnosis of sepsis, and then they return to your facility with a primary diagnosis of sepsis. Again, you'll see the display for those total encounters and that readmission rate. The next KPIs are mortality rate. So based on the filters that you have selected or the data that you have selected, you'll see that mortality rate. And then also the average length of stay. The last KPI I'll come back to after I demonstrate our main dashboard. So going from left to right, our first widget is that encounters by diagnosis-related groups. And these are the sepsis encounters categorized by the sepsis DRGs, that 870, 871, and 872 DRG. You'll also see here that we have an other category. And if I hover over our data points, we have the description and the total encounters. So the other DRGs are those encounters that have that secondary diagnosis of sepsis, but maybe they have another DRG, such as a pneumonia or a surgical DRG. They populate based on that secondary diagnosis of sepsis. I'll hover over our next data point, which is that 871 DRG. Again, you'll see that description, the total encounters, and that average relative weight. And this is based on that DRG average relative weight. The data points, you can also drill to additional detail. I'll give this example of drilling through to our principal diagnosis. So I've selected a DRG and drilled through to the principal diagnosis. So these are categorized into the principal diagnosis. In each of the data points, I have the ability to drill through to additional details for the encounter details. I'll give this example here, and we'll show that encounter detail table. The encounter details table populates those encounter details, such as your account number or your attending physician, that admission date or discharge date. Within the encounter details table, the columns, you have the ability to sort. So you may want to sort by that discharge date. You may want to sort by physician. Users also have the ability to search. So if you're searching for a specific account number or a specific provider, users have the ability to search within the encounter tables also. And for that deeper analysis for the encounter details table, the functionality is to export the data. So you can export this data to an Excel spreadsheet and do a deeper, further analysis of your encounter details. Again, this functionality is for all of the widgets and the data points within each of the widgets. I'm going to go back to our home page, and we'll go to our next widget, which is the average length of stay trend. The average length of stay trend for the blue line is displaying that facility average length of stay. And the orange trend line displays that national average length of stay. I currently have all encounters selected, so you're seeing this for all encounters. If I select a DRG, for example, of 870 in this prior widget, you'll see that my other widgets update. So now you'll see that that average length of stay changes based on the DRG selected. So I'll hover over our Q2 timeline, and you'll see that that average length of stay is 14.39, and the national average length of stay is 12.3. And again, this is that population of the DRG of 870. The next widget is the length of stay by number of days. This widget categorizes the length of stay into the number of days. So users may want to focus on those encounters that are staying greater than 14 days or that 8 to 14 day timeline. Again, you have the ability to select and drill through to those encounter details and do that deeper, further analysis of those encounters based on the timeline that you have selected. The next widget is the total 30-day readmissions by diagnosis-related groups. We also have the ability here to toggle and display the categorized by the index discharge disposition. So you may want to focus on a population maybe for those encounters that are being discharged to a skilled nursing facility. So here we can drill through and get into the encounter details of those encounters and do that deeper, further analysis. Within our encounter details for our readmission, we're showing that index account number and also the readmit account number and information for those encounters that are coming back to your facility. The next widget is our mortality rate trend. Here we're showing that mortality rate, and if I hover over the timeline, I'll see the total observed mortality and that mortality rate. You'll also see a toggle. We can toggle to another graph for that mortality observed over expected ratio. So for this widget, we're bringing over that risk model data for the mortality observed over expected. So these are those encounters that qualify for that clinical cluster for sepsis. If I hover over the timeline, my data point, I'll see that that mortality observed over expected ratio is 1.45 and the observed mortality of 63. The next widget is our encounters by gender and age. So these are our sepsis encounters that we have categorized by gender and age. You'll see the first line here is greater than 64 by female and male. This example I'll demonstrate, I can control and click both female and male of that greater than 64 population, and you'll see that my dashboard will update based on that selection. My KPIs and my other widgets will update based on that selection I selected. Now I'd like to go into our sepsis bundle encounters. By selecting this KPI, I can select and get into our sepsis compliance bundle page. The compliance dashboard is bringing in that DataVision severe sepsis and septic shock management bundle. You'll see that on our first graph, we are displaying those compliance, and then the orange indicates those of the non-compliance. We also have that compliance percentage trend line. So for this timeline, for example, Q1 2020, my compliance was 59.15%. You'll also see that we have a compliance percentage for that overall timeline. So I have a full year selected, and my overall compliance is 50%. But it's also broken down because I have a view by quarter, and I'm seeing each quarter over quarter compliance. We further break down in the graphs below for the severe sepsis 3-hour bundle and the septic shock 3-hour bundle. And also the blue indicates that compliance, and then the orange for the non-compliance. By right-clicking into the details, I can also look at those encounter details for those encounters that did not meet the compliance. So within the encounter details, for example, I can see those encounters that did not meet and the specific measures that they did meet. And if I select the toggle button, I'm then able to view that 6-hour severe sepsis and septic shock bundle. Again, the blue line represents the compliance and the orange line non-compliance. The trend line represents that compliance percentage. You'll also see that we have our global filters and our KPIs, much like the main page of the dashboard. Now I'd like to go back to our main page and demonstrate some of the functionalities within each of the widgets. For this demonstration, I will demonstrate the first widget, which is that encounters by diagnosis-related groups. Each of the widgets have the same functionality. So you'll see if I select focus mode, here the graph is in a larger view. So if you're doing a presentation or large screen, you may want to have a larger graph. You can select that focus mode to still hover over your data points and see this in a larger view. Users also have the ability to show as a table. So users may want to see that diagnosis-related groups, the full description, and those total encounters and average of relative weight in a side-by-side table. Again, you have the ability to hover over the data points and see more details. Users also have the ability to select Spotlight. And by selecting the Spotlight, it grades out the rest of the dashboard, and you're just spotlighting this one widget. And for graphs that have descending and ascending sort, you can sort these by either descending or ascending. And again, each of the widgets have the same functionality that I just displayed. And also, I know I did a demonstration for the encounter details on this widget, but each of the data points, you can filter, drill through further to those encounter details. That completes our demonstration of the Sepsis Insights Dashboard.
Now I would like to introduce our client panel, Penn Medicine Lancaster General Health. Lancaster General Health has been utilizing the Sepsis Insights Dashboard as a beta client, and we would like to discuss their experience and how they're using and plan to use the dashboard. From Lancaster General Health, we have Teresa Cranston. Teresa serves as the sepsis coordinator. Dr. Joseph Contra. Dr. Contra is Chief of Infectious Diseases and Chairman of the Sepsis Task Force. Betsy Stalker is the MIDAS Senior System Administrator, and Carol Eschbaugh, also a MIDAS System Administrator. First of all, thank you to our client panel for your participation today and with our beta process. I know based on working with this team that improving sepsis care is near and dear to your heart. Teresa, we will start our discussion with you. As the sepsis coordinator, you work with many providers and clinicians on improving sepsis patient outcomes. Share with us the value that the Sepsis Insights Dashboard provides to Lancaster General Health.
Hi, Jamie, and thank you for having me. I'm really excited to be here. I will tell you, I've really enjoyed using the dashboard. It provides great information for me as the sepsis coordinator. it provides not only that high-level review of those critical aspects to sepsis care, but it lets me drill down to, especially like that bundle compliance, where I'm able to drill down to those 3-hour and 6-hour core measure compliance pieces, but then also right down to the provider and the provider groups, so I can drive performance improvement and let those individuals know where we can improve for future times and not have those fallouts again.
Yeah, hey, this is Dr. Contra. Thanks for inviting us, and nice to be with you guys today. Yeah, I would echo all those comments. It's great as a frontline provider to be able to track individual compliance among our physicians and groups down to the individual patient and provider level. At the same time, this dashboard really allows us to take also a higher level look at mortality and readmissions data to kind of put it all together in what I've found to be a really friendly, a user-friendly environment, and one that we can manipulate and really drill down however we like. It's been a great experience.
Thank you both. Teresa, you and Dr. Contra just shared with us how the dashboard gives that ability to have that high-level review and also drill down. With that being said, who is currently using and who do you envision using the sepsis dashboard?
Well, excuse me. Well, currently, I use it. I use it pretty regularly. I jump in I would say on a daily basis to see what's been updated. I will tell you that Dr. Contra utilizes it as well as our system administrators. We were able to actually bring it to our sepsis task force last month and demo it, and there was a lot of good conversation about that. And I would say going forward, that's exactly where we want to bring that. Being able to show not only the bundle compliance and mortality, as well as the readmission data, I would imagine our liaisons from our sepsis task force utilizing that as well, and being able to give them access to actually drill down to not just the groups, but the individual providers.
I was going to say that we also have an interface in our sepsis task force with a lot of other hospital committees. For example, the hospitalist management committee in the ED, and I think we could envision using this dashboard to allow those providers to also log in and to take a look at the data. I think the more involved and trained you get people, the more likely they are to be compliant with what you want to accomplish. And I think definitely managing physicians among different areas in our hospital would be able to utilize this as well.
Great. So, Betsy, Teresa and Dr. Contra just spoke about the users and who they envision using it. But can you also elaborate and tell us how you're integrating the sepsis dashboard within the sepsis initiatives there at Lancaster General Health?
Yes, thank you. The Sepsis Insights Dashboard and its functionality is going to be shared at our monthly sepsis steering task force meetings. And participation in this group consists of executive leadership, key sepsis providers, and performance improvement members, as well as the teams that touch our sepsis patients across the continuum.
Yeah, Teresa, do you have anything else to add?
Yes, I just wanted to say that it allows me to actually build reports and contact those end users in reference to our sepsis compliance. And like Dr. Contra had mentioned, a lot of our across the continuum readmission data is very, very important, as like working with our home health agencies, as well as, like all those folks that touch the patients, PCP groups, and giving them that information.
Thank you, Teresa. You just kind of spoke on, the multiple data measures, and we presented multiple data measures within our demonstration and presentation. What data provided by the dashboard do you feel is most relevant to your current workflow when managing the sepsis population there?
I will just say I utilize almost each widget of that dashboard, I'm able to, a big focus, of course, is our bundle compliance, the 3 and 6 hour, and being able to drill down. I pull it over into Excel and drill down right to like the each component of those bundles. Mortality rates, of course, that's a keep your eye on all the time. Readmissions, of course, like I said in the previous question, I share that with, across the board, across our continuum of, everyone that touches our patient from admission right down to and out into the community, and sharing that to make sure that we keep our eye on those very key important indicators. And then length of stay and those trends. I like to be able to trend it, and being able to do it via quarterly as well as annually is the only way to actually drive performance improvement. And sharing that all, of course, at our task force with all of our folks has been so nice to have available to us.
Yeah, hey, this is Joe. The other thing I would mention is that when we're dealing with the C-suite, it's sort of an entirely different level of reporting, a much higher level, and to be able to generate those reports both at a C-suite level and then to be able to go back with Teresa and I as more boots on the ground to really be able to interface with the primary care and hospitalists, physicians in the hospital, those directly involved with patient care. We can do both of those things from this platform, which has been really helpful.
Thank you, Dr. Contra, for sharing both that provider and that administrative perspective. I think that's what we, really kind of want to focus on is not only that administrative level, but also the ability for those analysts to drill into the data for additional, analysis. So, Carol, I will turn to you for our last question. Can you describe with us your team's experience with the implementation of the Sepsis Insights Dashboard?
Yes, I'd be happy to do that. Let me start off by saying that we really appreciate the Conduent team giving us this opportunity today to share our experience with all of you. When we embarked on this project and agreed to be a beta partner several months ago, I don't know what our expectations exactly were, but fast forward to today, and I can say confidently for all of us involved with this at LGH that it has been a positive experience. It's really been great to work with the Conduent team. We found them to be professional, knowledgeable, and most especially very open to any suggestions and input we had. Teresa and Dr. Cranston suggested several enhancements to the dashboard, and the Conduent team worked very hard to implement these enhancements. We found that any issues that were identified, they fixed them very quickly. So to sum up, we found working on this project to actually be a pleasurable one. And we're excited to see how the dashboard will continue to evolve over the coming months. So thank you. That was a nice synopsis, Carol, and I certainly agree with everything Carol said. They were a pleasure to work with, and they listened to us and made the changes accordingly. Thank you.
Thank you, Betsy and Carol, and thank you again to our entire client panel. We appreciate your time today, and again, much appreciate your work with us as a beta client. So now I would like to discuss our key takeaways and do a brief recap from our presentation today. We discussed the staggering numbers related to sepsis, including that high mortality and readmissions. We also demonstrated the Insights Dashboard that allows facilities to identify the sepsis population and those key metrics. The goal as healthcare providers is to improve the overall patient outcomes. In order to accomplish this, it is important to identify opportunities with timely and accurate data. This data analysis, in addition to the sepsis quality initiatives, will help decrease financial burden and, most of all, save patient lives. I hope you've had time to enter your questions in the chat window. Please take the time now to enter your questions if you've not already. And we will turn it over to our moderator, Anna Daly, to review our Q&A from our audience.
Thank you, Jamie. And also thank you to Sarah and the Lancaster General folks for what a great presentation and conversation. So let's move on to our Q&A session. We do have a couple of questions that have come up. The first one that that I'm seeing is this dashboard available for DataVision clients? And Jamie, would you mind speaking up and talking through the process for accessing the data, or not accessing, but getting to the dashboard and who it is available for within the DataVision system?
Yeah, sure, Anna, thanks. So the dashboard is available as an add-on for our DataVision clients. So I would tell our clients to work with their client manager or the account executive for additional information about contracting and getting the implementation for the dashboards.
Okay. And like Jamie said, this is an add-on to DataVision, so you can just contact anyone that is your client manager or your account executive. They can help you get access to the dashboard, but it does require a separate addendum to your existing DataVision contract. Another question that's come up is what data is used to populate the sepsis dashboard?
Yeah, I can take this one too as well. So encounter level data from the care management is the source of truth for each of the widgets on the main page. I also shared the compliance bundle information, and that and the mortality observed over expected ratio is extracted from DataVision.
Okay. So we're using Midas products throughout
Yes.
this to support the dashboard. Okay, perfect. So another one, once you have access to once you have contracted for the dashboard, how do users access it? Is it through the DataVision application, or is there another means for accessing the dashboard?
Yeah, so once the contracting is completed and the dashboard's implemented for that facility, users will have access through the client's only website.
And is that something that can be added onto, or how do users get additional, how do the individual clients get additional users added to their clients only availability?
Yeah, so that system administrator who would set up those users for the dashboard, so they have that ability to add or remove users for their facility within that client's only website.
Okay. And I think that the final question that I'm seeing right now is, since we have already talked about that the data, the primary source of truth for the data is the care management application, with all the activity in care management right now, is there a specific version of care management that's required for the dashboard?
That's a good question. So the Sepsis Insights Dashboard is compatible with all versions of Midas Care Management. However, there are some technical requirements, which includes the 4.5.2 version of .NET Framework. And operating system minimum requirement is the Windows Server 2008 R2. So the dashboard is web-based, so that it is supported for the internet browsers that are supported include Google Chrome, Microsoft Edge, Firefox, Apple Safari, and Internet Explorer 11.
Wonderful. Those are the questions that I've had. Oh, we've got another one coming in here. Let me see what we've got here. If compliance data is taken from Midas, does this include core measure abstracted data or does this include compliance data on all sepsis patients? So are we only looking at the core measure abstractions, or are we looking at all sepsis patients?
This is from the abstracted data. So this is once the abstracting is completed.
Okay. All right. Do we have any others that have come across? All right. Well, thank you all for your time today. If you want to learn more about our Sepsis Insights Dashboard or our advanced analytics solutions, please feel free to reach out to any of us visit any of us through www.conduent.com/healthcare-provider-solutions, or you can email us at hcpprovider@conduent.com. We would be more than happy to give you an in-depth demonstration of our technology tools. So this is going to conclude our webinar today. We hope that you found it informative and educational. I really want to thank Jamie and Sarah for giving the demo and discussing through some of the challenges. And we want to thank the Lancaster General Health team for taking time out of their day to be with us and really sharing their experiences and insights. And as Jamie has said before, thank you so much for agreeing to be a beta client for us. And we have equally enjoyed the experience that we have had in serving you in that process. We hope you enjoyed the webinar and that you'll join us for future Conduent Healthcare sessions. Thank you so much for joining us today, and I hope you all have a great day.